Welcome to this presentation on Supervisor Health and Safety Awareness in 5 steps. Prevention starts here. The content in this presentation is directly from the Ministry of Labor Supervisor Health and Safety Awareness in 5 Steps Workbook for Workers. You can download the PDF version of this workbook at the site noted here. Ontario's Occupational Health and Safety Act defines a supervisor as anyone who has charge of a workplace or authority over a worker. This training is designed to help you understand what the Occupational Health and Safety Act expects from you. These are the things you need to know and understand so that you and the people you supervise can be healthy and safe at work today and every day. Everyone in the workplace, from the employer to the newest worker, has different but important duties to keep the workplace safe. Because employers have the most authority in the workplace, they have the greatest responsibility for health and safety. Supervisors are next in line. Since your job involves taking direction from your employer and giving direction to the workers you supervise, it's important for you to understand the health and safety responsibilities of everyone in your workplace, including yours. The focus of this training is on general awareness of rights and responsibilities under the Occupational Health and Safety Act and does not in any way replace the Occupational Health and Safety Act or its regulations or any other knowledge, information, or training that you will require as a supervisor. Prevention starts here with the things you learn in this workbook, but it doesn't end here. Above and beyond what is covered in this training, your employer has the duty under the Occupational Health and Safety Act to make sure that you are competent before appointing you, and to inform you of any hazards in the work which you supervise. We hope that you will use what you learn here every day in your work as a supervisor, so that you are more confident asking your employer questions about workplace health and safety and your duties. This presentation will look at the 5 steps for Supervisor Health and Safety Awareness. Make a difference. Lead the way. Supervisor's Toolkit. You are not alone. And be a role model. Welcome to the first step of Supervisor Health and Safety Awareness. Make a difference. In this section, we will discuss why the supervisor is so important, your duties as a supervisor, and the duties of the worker and the employer. When a person is hired or promoted to the position of a supervisor, it usually means a pay raise, but it also means more responsibilities, including legal responsibilities relating to the health and safety of the workers under your supervision. It's a natural thing for a new supervisor to wonder if he or she is up to the challenge. In fact, asking yourself that question will help you figure out what additional information or instruction you might need to do your job well. People expect a lot from a supervisor, no matter how big or small the workplace is. A healthy and safe workplace matters to everyone, and the Occupational Health and Safety Act expects supervisors to be the frontline guardians of healthy and safe workers, whether the work is performed on a construction project, in a healthcare facility, an industrial establishment, or in a mine. Every good employer also expects that from you, and so do the people that you supervise. A supervisor has to play a lot of different roles, often at the same time. Think about the roles that play at a basketball game. From the list on the right-hand side, think about some of the roles that you think apply to a supervisor's work. Would they be considered a coach, a trainer, a referee, a cheerleader, or a captain? If you haven't checked off all of the above boxes, then go ahead and do it now, because chances are that you will be called upon to play any or all of the above roles as you strive to keep your workplace healthy, safe, and productive. As a supervisor, you are a crucial part of your workplace's internal responsibility system. This is a very important concept for workplace health and safety, and you will learn more about this throughout this training. The number of people in Ontario who suffer a work-related illness or injury each year would fill the seats of a dozen big hockey arenas. New and young workers in Ontario are 4 times more likely to get hurt during the first month on the job than at any other time. They often aren't told about or understand the hazards of the job. They don't know what to expect from their employer and supervisor. Sometimes they aren't sure what questions to ask. Sometimes they don't know who to ask. That's where you come in. It's a big challenge, but it's also a big opportunity to make a difference. The duties of the supervisor can be found in the Occupational Health and Safety Act, Part 3, Section 27. It gives you specific duties related to your role as a supervisor. The first is to tell the workers about hazards and dangers in the workplace and show them how to work safely. The second is to make sure that workers follow the law and the workplace health and safety policies and procedures. Another duty is to ensure that workers wear and use the right protective equipment and to do everything reasonable to keep workers from getting hurt or sick on the job. The Occupational Health and Safety Act requires every employer to prepare a written occupational health and safety policy for that workplace and to develop and maintain a program to implement that policy. One of your tasks as a supervisor is to put that program into action. Here's how to do it. You know the Occupational Health and Safety Act and the various regulations attached to it that apply to your workplace. A supervisor who knows and understands the Occupational Health and Safety Act and regulations can make sure workers follow the law and can identify ways to make the workplace safer. The various regulations under the Occupational Health and Safety Act contain detailed requirements about how to make the workplace safe. For example, several regulations, such as the Workplace Hazardous Materials Information System, or WHMIS regulation, which explains what workers need in order to work safely with chemicals and other hazardous materials or designated substances, things like training, warning labels on products, and information sheets. There are also regulations that specify requirements for different types of workplaces, such as construction projects, healthcare facilities, industrial establishments, and mines. Make sure workers wear and use the right protective equipment. Your employer is responsible for telling you what types of protective equipment, device, or clothing they require workers to use or wear, and both of you are responsible for making sure the workers are using or wearing it. That means you need to know and understand the requirements in the Act and its regulations about equipment, devices, and clothing, as well as your employer's health and safety policy, program, and work procedures. You tell workers about the hazards in their work. Every workplace has hazards. Hazards include anything in the workplace that can hurt workers or make them sick. A supervisor must be able to explain the actual and potential dangers involved in the work he or she is supervising and ensure that the workers do their work safely. A few regulations even say that you have to give written instructions that tell the workers what steps and procedures must be followed to stay safe. You need to know about these regulations if they apply to the work that you are supervising. Your general duties as a supervisor also apply to the prevention of workplace violence. You plan the work so that it can be done safely. The people you supervise are relying on your knowledge and experience of the work to make sure that it's done safely. The Occupational Health and Safety Act requires employers to make sure that you have the necessary competence to be a supervisor. Later, we will look at this responsibility in more detail. You make sure workers know and follow through on their health and safety duties. It's your job to monitor the work, to remind workers of their health and safety duties if necessary, to show them how to work safely, and to enforce the employer's workplace health and safety policies and procedures if they aren't being followed. Doing the 5 things that we have just reviewed will help you carry out your duties under the Occupational Health and Safety Act. To make sure you're doing your job right, here are a few important questions that you should ask yourself. Do I understand the Occupational Health and Safety Act and the regulations that apply to the work that we do? Can I explain these sections of the Occupational Health and Safety Act and regulations to the workers? Am I informing the workers about hazards? Have I planned the work so it can be done safely? And am I making sure that the workers wear or use the protective gear, clothing, and devices as required by the employer? As you can see, a supervisor has a lot of serious responsibilities. To carry out those responsibilities, you need the help of your employer and of the people you supervise. The Occupational Health and Safety Act gives duties to employers and workers that will help you do your job. The Occupational Health and Safety Act says it's the employer's duty to appoint a competent person as a supervisor. To be a competent supervisor under the Occupational Health and Safety Act, you must have knowledge, training, and experience to organize work for your workers. You must be familiar with the Occupational Health and Safety Act and the regulations that apply to the work you are supervising. You must also have knowledge of any potential or actual danger to health or safety in the workplace. Your employer must ensure that you are competent before you start supervising. This includes ensuring that you know the Occupational Health and Safety Act and the regulations that apply to the work, and that you know about any potential or actual dangers to the health and safety in the work that you are supervising. If your workplace is a small one and the supervisor and employer are the same person, then that one person must comply with both employer and supervisor duties. Here are some other things that the Occupational Health and Safety Act says the employer must do. Where there are more than 5 workers regularly employed in the workplace, they must create and review on an annual basis a health and safety policy. They must develop a program to implement that policy and post the policy in the workplace. For all workplaces, make sure that workers and supervisors know about the hazards in the work that they do and provide them with information, instruction, and supervision to protect their health and safety. They must take steps to eliminate hazards in the workplace, and where elimination is not possible, to control them. They must make sure workers use and wear protective equipment, material, and devices where required by the regulations. And they must do everything reasonable in the circumstances to protect workers from being hurt or getting a work-related illness. The Occupational Health and Safety Act also gives workers certain duties that support your role as a supervisor. Workers have to follow the law and the workplace health and safety policies and procedures. They have to use and wear the protective equipment required by the employer. Workers have to act in a way that won't hurt themselves or anyone else. And if workers see anything that's unsafe or that goes against the act, they have to tell you or the employer about it, so that way you can take the necessary steps with your employer to solve the problem. They have to report to you or the employer the absence of or any defect in any equipment or protective device of which they become aware. This concludes step 1, make a difference. As a supervisor, you can make a difference in your workplace, but you can't do it alone. You need your employer and the workers you supervise to do their part to keep the workplace safe. Like you, they need to be aware of the health and safety duties under the Occupational Health and Safety Act and regulations. That's the first step in creating an effective internal responsibility system. Remember, prevention starts here, but it doesn't end here. This next section takes a look at Step 2 in Supervisor Health and Safety Awareness. Lead the way. Step 2 takes a look at teamwork and the internal responsibility system and the 3 rights of workers. People in successful workplaces understand that a safe and healthy workplace is a productive workplace. They also know that they have to work together to create and maintain a safe and healthy workplace. As you have seen, the Occupational Health and Safety Act is very clear about the different roles of the employer, supervisor, and worker, and how those roles cooperate to make a safe and healthy workplace. This is the Internal Responsibility System, or IRS, as it is commonly known. Communication is a big part of the IRS in any workplace, and the ability to communicate effectively is an important skill for any supervisor. To communicate effectively, you need to be good at both listening and speaking. You need to be a leader as well as a supervisor. A leader adds to the supervisor's basic role of overseeing the work by listening to the workers, trying to understand their point of view, supporting them when they need help, and always setting a good example. As the person in the highest leadership position, the employer has the most important role in creating an effective internal responsibility system in the workplace. You need the support of the employer to carry out your supervisor duties, and the workers need to know that their supervisor and employer will listen to their concerns and work with them to recognize, assess, and control hazards. In fact, the Occupational Health and Safety Act says that workers have the legal right to expect that support. You should inform the employer of any health and safety concern, even if you have the ability and authority to handle it yourself. Your employer may need to know about the problem in order to fulfill his or her duties. The Occupational Health and Safety Act gives workers 3 important rights. The right to know about workplace hazards and what to do about them. The right to participate in solving workplace health and safety problems. And the right to refuse work if they believe it is unsafe. As a supervisor, it's important to know and understand those 3 worker rights. They are at the heart of the Occupational Health and Safety Act and the Internal Responsibility System, and they connect directly to your duties as a supervisor and those of the employer. Here's how. It's your job to tell the workers about any health or safety hazards and to show them how to work safely. This supports workers' right to know about hazards and to which they might be exposed. For example, the law says workers have to receive information and training on the chemicals or hazardous materials that are used, handled, or stored at work. This information is available either on the warning labels or information sheets. Sometimes you may also have to give the worker written instructions on how to do the work. The employer supports the worker's right to know by making sure they get information about the hazards in the work they are doing. As well, training to do the work in a healthy and safe way, and competent supervision to stay healthy and safe. That means the employer has made sure that you know how to do your job. As a supervisor, you support the worker's right to participate in a health and safety by encouraging them to get involved. There are various ways to be involved in the workplace health and safety, such as asking questions, raising concerns, and giving positive feedback. One of the most effective ways workers can participate in health and safety is by becoming a health and safety representative or a joint health and safety committee member. Can you think of any other ways a supervisor can support the worker's right to participate in health and safety? As a supervisor, you also support the workers' right to participate in health and safety by encouraging them to speak up and listening to their concerns. As well, doing what's necessary, often with the employer's help, to control the hazards that they identify, and acknowledging their efforts to make the workplace safer and healthier. The third right of workers in the Occupational Health and Safety Act is the right to refuse to do work that they have reason to believe is unsafe for them or another worker. As a supervisor, you respect that right by taking every precaution reasonable in the circumstances to protect workers and by complying with the process for work refusal specified in the Act. When a worker comes to tell you that he or she is refusing to do a particular work because it is likely to endanger him or herself, you must look into the worker's concerns and do everything you can to help the employer address them. Most of the time, the employer or you will be able to solve the problem with the worker's health and safety representative or joint health and safety committee member. But if you can't agree on how to solve it and the worker still feels that the work is unsafe, a Ministry of Labor inspector will be called in to investigate. There is a detailed description of the work refusal process and the steps to take in the Ministry of Labor's Guide to the Occupational Health and Safety Act. Supervisors are also workers. As a worker, you too may exercise the right to refuse unsafe work in the circumstances specified in the Occupational Health and Safety Act. As we saw earlier, the Act prohibits the employer from reprising against a worker for such things as complying with the Act or seeking its enforcement. Together, the occupational health and safety duties support a strong internal responsibility system in the workplace. Different people have different roles or positions, but they all have the same goal. As a supervisor, you can be a leader in making your workplace safer and healthier, but you can't do it alone. In most workplaces with 6 to 19 regularly employed workers, the Occupational Health and Safety Act makes the employer responsible for ensuring that the workers choose a health and safety representative. In most workplaces where there are 20 or more regularly employed workers, the Occupational Health and Safety Act says the employer is responsible for making sure a joint health and safety committee is set up. The committee has to have at least 2 people on it, and one of them has to be chosen by the workers. Workplaces with 50 or more regularly employed workers must have a joint health and safety committee with at least 4 people on it, with 2 of them chosen by workers. Generally, joint health and safety committees must have a worker representative and an employer representative who are certified members. The committee has many powers, including the power to identify workplace health and safety problems and recommend to the employer ways to solve problems and improve health and safety in the workplace. For example, a member of the committee who represents workers must regularly inspect the workplace. Information from these inspections is brought back to the committee. The committee then makes recommendations to the employer to improve health and safety. The employer has to respond to these recommendations within 21 days. Because the employer and the workers are represented on the committee, everybody has a role in recognizing, assessing, and controlling hazards. For more details, you can visit the Ministry of Labor's Guide to the Joint Health and Safety Committees located on their website. In smaller workplaces, the health and safety representative has a similar role in helping improve health and safety conditions. Their duties and powers, like those of a joint health and safety committee, include inspecting the workplace regularly and making recommendations to the employer about how to fix hazards and solve other health and safety problems. This concludes Step 2, Lead the Way. The next section will take a look at the Supervisor's Toolkit. This next section talks about the Supervisor's Toolkit. It is Step 3 of the Supervisor Health and Safety Awareness. This section talks about knowing the hazards in your workplace, dealing with hazards, and handling problems as they arise. One of your jobs as a supervisor is to help plan and organize the work. This is a big job. To do it well, you need to understand the work and the hazards associated with it. You also need to know how to eliminate or control those hazards and to make sure the health and safety program implemented in your workplace is effective in doing so. Here are some of the most common hazards in Ontario workplaces, particularly in healthcare settings. Repeating the same movements over and over, especially if you are in an awkward position or you use a lot of force. Think of someone who bends down all day or someone who lifts heavy things over and over again, especially above the shoulders or below the knees. Slipping, tripping, or falling. Think of something as simple as spilled coffee on the floor, a cluttered work area, or a raised platform with no guardrails. Musculoskeletal injuries. The dynamic healthcare environment demonstrates that workers are prone to injury through a host of factors unique to them being directly involved in patient care. Females, representing an overwhelming proportion of the healthcare workforce, have a higher incidence of falls, low back symptoms, repetitive motion disorders, and high-cost injury claims. However, men are also at risk for musculoskeletal injuries in the healthcare setting. Needle sticks and other sharps-related injuries which expose workers to bloodborne pathogens continue to be a significant hazard for healthcare workers. Workers handling sharps are at risk of occupational exposure to bloodborne pathogens. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans, such as hepatitis B, hepatitis C, as well as HIV, to name a few. Another hazard is workplace violence. It can happen in many workplaces, such as a gas station attendant working alone at night, or to a healthcare worker or a home care worker in those settings. Can you think of other common workplace hazards, especially ones in your own workplace? Some other common workplace hazards might include things such as lighting, noise, electricity, and other energy sources. An object that could fall from a height. Confined spaces. A high-temperature material or process. Sharp objects or equipment. You also need to think about less apparent hazards, things like chemicals, fumes, toxic dust, or germs and viruses in workplaces such as schools, labs, and healthcare facilities. Some of these hazards can make a worker very sick. Sometimes the worker gets sick right away. Other times the worker doesn't know that he or she is sick until months or even years later. That's why it's important that you know about these hazards now. Understanding the Occupational Health and Safety Act is all about knowing the health and safety duties of employers, supervisors, and the duties and rights of workers and putting them into action. We all have to get involved. One of your employer's duties is to make sure that the supervisor knows enough and has the experience and necessary training to keep workers safe. One of a supervisor's duties is to inform workers of health and safety hazards. If a worker sees a hazard or practice that goes against the Occupational Health and Safety Act or workplace health and safety policies and procedures, that worker has a duty to tell the supervisor or employer. This should be done as soon as possible so that the hazard can be fixed. That's how employers, supervisors, and workers come together to make the workplace safer. This is an example of the internal responsibility system in action. RACE is a commonly used process for dealing with hazards. RACE stands for Recognize, Assess, Control, and Evaluate. These steps, when done in order, help the workplace identify and control hazards. Supervisors are encouraged to communicate with workers, the employer, and the Joint Health and Safety Committee or Health and Safety Representative throughout this type of process. The first step of this process, recognize. Recognize where there are potential hazards in the workplace. Here's how you go about doing that. Watch the work as it's being done. Talk to the workers about the work and the areas where work happens. Participate in workplace inspections. Look at reports and records that your workplace has about the work and listen to the concerns workers have when they are doing the work that they're doing. Next, it is important to assess the hazard. You need to understand how likely it is that a worker will get hurt or made sick by the hazard. To assess the hazard, you can ask these questions. How does the hazard compare to legislation, standards, and guidelines? How can the worker get hurt or sick? How likely is the hazard to affect worker health and safety? And how badly could the worker get hurt or sick? Next, you want to control the hazards by looking for ways to get rid of the hazard or to make the job safer. The safest thing to do is to remove the hazard. If removing the hazard is not possible, look for ways to prevent workers from coming in contact with the hazard, such as separating the hazard from the worker. If neither of the above solutions protects the worker can use protective equipment, devices, or other materials to help them keep safe. It's your obligation as a supervisor to make sure that workers use this equipment where required by the Occupational Health and Safety Act and regulations or by the employer. Finally, you want to evaluate how well the hazard controls are working. Talk about the work to the workers who report to you. Watch them do their work and listen to what they say and look for ways to improve health and safety. The RACE process is one good way to get a close look at the work and the hazards associated with it. You are always keeping your eyes and ears open for hazards. You pay attention to the way people are doing their work and you listen to their concerns. If you find a hazard, you know that you need to do something about it. You use your experience and the information and training you got from your employer to help you make decisions on what to do. If you don't know how to deal with the hazard, talk to your employer. You can also involve the Health and Safety Representative or Joint Health and Safety Committee if there is one. And you can refer to external sources such as legislation, standards, codes, or expert consultants to help you solve the problem. If necessary, you can stop the work until you know that it's safe. The RACE process is a way to help you deal with hazards, but it isn't everything. You also need to monitor the work. This means that you need to take steps to make sure that the workers understand the information you gave them and are following the workplace safety procedures and are using or wearing their protective equipment. If you see a worker exposed to a hazard, it's your job to talk to them about it. You have to make sure that the Occupational Health and Safety Act, any applicable regulations, and the workplace safety procedures are being followed, and you have to enforce those procedures. Sometimes things can go wrong. When that happens, you need to be clear on what steps you have to take. Let's say someone you supervise has been injured. What are the steps you think you should take? Make sure the injured worker gets the necessary first aid and or professional medical attention. Inform the employer of the incident so that the Ministry of Labor and other relevant parties can be notified. Secure the incident scene to prevent any further injuries and to help the investigation of the incident. Participate with the Joint Health and Safety Committee or Health and Safety Representative in the investigation of the incident. As you can see, there is definitely a lot to know when you're a supervisor. It's an important role, and if you don't carry out the duties that are assigned to you by the Occupational Health and Safety Act, you can face consequences. For example, a Ministry of Labor inspector could issue an order against you. Also, you could be charged with an offense. This is serious work, and it may seem overwhelming at first, but you don't have to do it alone. If someone comes to you with a health and safety concern or to report a close call, you need to listen to them because these are warning signs of potentially serious problems ahead. You also need to inform your employer of these concerns. If you can solve a problem on your own or with the worker, you should do that. If you need help, you should ask your employer. Your health and safety representative or joint health and safety committee are also there to provide information. Reports from workplace inspections by health and safety representatives or your joint health and safety committee, along with incident investigations done internally or by the Ministry of Labor, are important tools in your supervisor's toolkit. When they're used effectively, they help control hazards and prevent injuries. This concludes Step 3, the Supervisor's Toolkit. Welcome to Step 4 of the Supervisor Health and Safety Awareness. You are not alone. In this section, we will discuss getting the help you need and where else you can go for assistance. In addition, we will take a look at Ontario's health and safety system partners. Many supervisors are promoted to that position because they were good at their previous job. They learned as much as they could about that job, the hazards involved, and how to work safely. They knew how to do their work in a safe and healthy way, but they may not be too sure about what's involved in supervising work. Now they are a supervisor and their duties have changed. But do they know everything they need to know about this new role? That's the question you should ask yourself. You may know a bit about the Occupational Health and Safety Act and the various regulations that are attached to it, but do you know enough about the specific requirements in the Occupational Health and Safety Act and about which of its regulations apply to your workplace? You may have the necessary experience in the work that you are being called upon to supervise, but do you know enough about what's actually involved in supervising workers? It's a sad fact that in some workplaces, nobody pays much attention to safety. In those workplaces, it's all about doing the work as quickly as possible. If someone questions the way that things are being done, they may get a dirty look, but nothing is done to make things safer. People in workplaces like that are often afraid to do anything about it because they don't want to get fired, so they keep quiet. Maybe you felt that way in a past job. That's why it's important to know that you are not alone. Help is always available from outside the workplace. If you see something unsafe that could hurt someone, it needs to be reported to the supervisor or employer. It's also a good idea to tell your health and safety representative or committee if there is one. But if the employer or supervisor doesn't fix the problem, the Ministry of Labor can be called. The ministry's job is to help prevent workplace injuries and illnesses through enforcing the Occupational Health and Safety Act. They want to know if there are problems that aren't being fixed. Think back to what you learned in Step 1. You were told that the Occupational Health and Safety Act requires the employer to make sure that the supervisor is a competent person. It's the employer's job to see to it that you have what you need to do your job competently. The Occupational Health and Safety Act emphasizes 3 things in particular that you need in order to be competent at your job. The Occupational Health and Safety Act says it's the employer's duty to appoint a competent person as a supervisor. To be a competent supervisor under the Occupational Health and Safety Act, you must have knowledge, training, and experience to organize work for your workers. You must be familiar with the Occupational Health and Safety Act and the regulations that apply to the work that you are supervising. You must also have knowledge of any potential or actual danger to health or safety in the workplace. We have reviewed the various duties that the Occupational Health and Safety Act assigns to you as a supervisor. If you feel that you don't have the necessary knowledge, training, and experience to carry out those duties, it's important that you talk to your employer. Tell him or her that you are happy to be a supervisor, but that you need more information and training in certain areas to do your job. Perhaps you need to attend a training course on the Occupational Health and Safety Act and regulations. Maybe you need to learn more about how to recognize, assess, and control hazards, and to evaluate the hazard controls. Maybe you want to know more about leadership skills and communication, about how to develop your listening skills, and about what the workers expect from their supervisor. Remember that your employer needs to give you the tools to become a competent supervisor. Even when you have the necessary knowledge, training, and experience to be a competent supervisor, fixing a health and safety problem will sometimes be out of your control. Maybe it's a hazard that affects the whole staff, or it might cost a lot of money to fix, and you may not be able to approve that expense. If that happens, you need to let your employer know that you need help with solving the problem. Bring the ideas you got from the workers and from the health and safety rep or committee. Together you can figure out the best way to eliminate or control the hazard. The workers need to know that you will do what's right for them, and you need to know that the employer will do what's right for everyone. The Occupational Health and Safety Act supports a coordinated approach to the workplace health and safety by giving everybody duties according to their position at the workplace. The higher your position is, the more duties you have. When you put all of these duties together, you get a strong IRS in the workplace. Sometimes a worker will come to you with a question and you just don't know the answer. Oftentimes the answer is right in your workplace. You can find answers in the workplace health and safety policies and procedures, the safety data sheets that come with hazardous materials, the operating manuals for equipment, or the recommendations of the Joint Health and Safety Committee or Health and Safety Representative. Sometimes you might not understand what the Occupational Health and Safety Act and regulations are telling you to do, and even your employer might not fully understand. That's when you need to go for outside help. For example, the Ministry of Labor website offers many helpful resources, including a downloadable guide for the Occupational Health and Safety Act that provides a plain language explanation of the various parts of the Act. Ministry of Labor inspectors can't be in all workplaces at all times, but the ministry wants to hear if there's a problem on the job that isn't fixed anywhere in Ontario. So it has a toll-free number that you can call. Calling that number connects you to the Health and Safety Contact Center that takes care of calls 24 hours a day, 7 days a week. If you don't want to give your name when you call the Health and Safety Contact Center, you don't have to. Here is the number, 1-877-202-0008. Remember we mentioned reprisals before? It's against the law for your employer or supervisor to fire or punish you for doing what the Occupational Health and Safety Act expects you to do, or because you ask them to do what the Occupational Health and Safety Act expects them to do. It's even against the law for your employer or supervisor to threaten to fire or punish you for these things. The Occupational Health and Safety Act is very clear on this. If the worker has reason to believe that the work that they are doing or the equipment that they are using might hurt them or someone they work with, they can refuse to do that work. This means that the worker tells you, the supervisor and/or the employer, and your health and safety representative or committee that they think that they are in danger and they are not going to do the work. They must tell you why. All workers have the right to refuse work if they have reason to believe that it's dangerous. It's important to know that you can also refuse work if you have reason to believe that the area where you are working is likely to endanger you or any other worker, or that you are in danger from workplace violence. The situation must be reported to the supervisor and/or the employer, as well as your health and safety representative or committee. If the problem isn't fixed, or there is still reason to believe that the work is unsafe, the worker can still continue to refuse work. A Ministry of Labor inspector will then be called to investigate. Some workers, such as nurses, firefighters, and police officers, cannot refuse work if the danger is a normal part of their job, or if refusing work could put someone else in danger. Talk to your union, other workplace representatives, supervisor, or employer if you think that your right to refuse the work may be limited by the work that you do. Ontario has a health and safety system which includes the following partners. The Ministry of Labour develops, communicates, and enforces occupational health and safety requirements and employment standards. Develops, coordinates, and implements strategies to prevent workplace injuries and illnesses, and can set standards for health and safety training. The Workers' Health and Safety Center is an occupational health and safety training center for workers, representatives, and employers. Occupational Health Clinics for Ontario Workers is comprised of 6 medical clinics located across Ontario that provide occupational health services and information. 4 health and safety associations that provide sector-specific consulting, training, products, and services can be found on the website www.healthandsafetyontario.ca. Those associations include the Infrastructure Health and Safety Association, which serves electrical, construction, and transportation sectors. The Public Services Health and Safety Association serves health, education, and municipal sectors. Workplace Safety North serves mining, pulp and paper, as well as forestry sectors. And last but not least, Workplace Safety and Prevention Services serves industrial, farming, and service sectors. The Workplace Safety and Insurance Board administers Ontario's no-fault workplace insurance for workers and their employers. This system is there to serve everyone in the workplace, employers, supervisors, and workers. Another place you can go for this information is the Canadian Centre for Occupational Health and Safety. They have information and fact sheets on their website. If you are having trouble finding information, you can ask questions by telephone at 1-800-668-4284 or through their website at www.ccohs.ca. Last but not least, Step 5, be a role model. In this section, we'll talk about how to send the right message. Telling people to work in a safe and healthy way isn't all there is to being a supervisor. Sometimes people want to take shortcuts because they think it will help them to get the job done faster. Sometimes they're tired or having a bad day. There will be days when you're tired or having a bad day too, but you need to be a role model for safety at all times. As a supervisor, you need to follow the workplace safety procedures, wear your personal protective equipment, and stay safe. If you don't do those things, others will think it's okay to not follow the workplace safety procedures. People are watching you and learning from what you do. How you supervise the work, the way you think about the work and talk about it can affect the safety of the people that you supervise. You want to help the workers choose the safe path every time. You can help them by being easy to talk to and answering their questions. But the best thing that you can do is practice what you preach. That means always complying with the Occupational Health and Safety Act and following the healthy and safe work practices in your workplace. It means explaining how to work safely and correcting unsafe work situations whenever you see them. If you walk by a worker who isn't following the correct procedure or using the right safety gear and you do nothing about it, what message are you sending to that worker and everyone else? The message you send if you ignore health and safety infractions is that safety doesn't really matter. That's not the message you want to send, and it's not the message that the Occupational Health and Safety Act expects you to send. As we saw earlier, the Occupational Health and Safety Act supports a coordinated approach to workplace health and safety. To be a part of this, you have to understand your legal obligations and put what you know into action. So does everyone else in the workplace. That's how the internal responsibility system works. If the employer knows about a hazard and doesn't take steps to eliminate or control it, as well as make sure the workers are told about it and how to deal with it, that employer is not doing what the law requires. If the supervisor knows about a hazard and doesn't explain to the workers how to deal with it, that supervisor is not doing what the law requires. If the worker knows about a hazard and doesn't report it to the supervisor or employer, that worker is not doing what the law requires. The internal responsibility system is all about people coordinating to recognize, assess, and control hazards in the workplace and to evaluate hazard controls. Every supervisor has a key role to play in that system. Remember when you were starting out on the job and you felt a bit overwhelmed by all the things you didn't know? Remember that one person, a supervisor or coworker who took the time to show you things? We all have someone we can think of who helped us settle into a job. They gave us useful tips. They kept us out of harm's way until we learned what we needed to know for ourselves. Well, now it's your turn to give back. You are the supervisor. You are the person with the know-how and experience. If you don't feel that you know enough to carry out your health and safety duties as a supervisor, it's important that you talk to your employer and make sure that you get the information that you need. Keep an eye on the new worker and everyone else you supervise. Even those who don't ask you questions are counting on you to show them the right way to do things. By always showing your commitment to health and safety, the people you supervise will follow your example. Prevention starts here, but it doesn't end here. This concludes the Ministry of Labor Supervisor Health and Safety Awareness in 5 Steps, a presentation for supervisors across Ontario. The content of this presentation is directly from the Ministry of Labor Health and Safety Awareness for Supervisors Workbook and can be found on their website.